Congratulations, you've just had your braces fitted. Now, let's go through a few important points to help your treatment go as smoothly as possible. Braces are made up of lots of different parts. On the screen, you will see the most common features of braces. It is good to learn these new words to help you communicate with us during your treatment. The important thing to know is that the braces are individually glued onto your teeth. These braces helps to hold a main wire that will gently guide your teeth into its correct position. You may have a spring on your wire to help open up spaces. Be sure to spend extra time cleaning these. If you look closely, you will also see a small metal sleeve crimped onto the wire itself. This is called the arch wire stop, and this will prevent your wires from sliding around in your mouth during treatment. To ensure your treatment stays on track, we ask you to look after your new braces. Your braces need to stay firmly attached onto your teeth so that the wires can move them into their correct positions as efficiently as possible. To help you get started, we've included a little care pack for you. You will notice on the top there is some orthodontic wax. Next to it is interdental brushes, along with some toothpaste, a mouth mirror to look for any sharp bits of wire, and a travel toothbrush. While the braces with the brackets and the wires will effectively straighten your teeth, elastics are often required to help your top and bottom jaw come together into a functional bite. Your orthodontist will have shown you exactly how to wear these elastics. Now, it is your job to change these elastics a few times a day so they stay nice and stretchy. Ideally, you would want to eat with the elastics on as well. If it is too difficult, please take the elastics out, have your meal, brush your teeth, and grab a fresh elastic to put back in the same way. You will be told if these elastics are to be worn full time or only at nights. If instructed to wear full time, please ensure you have the elastics on all the time, meaning 24 hours a day. When the elastics are worn properly, it is extremely efficient. When they're not worn properly, you will find that we'll ask you to continue to wear these elastics for months on months. Now, in your elastic pack, there is about 200 elastics in there, so please feel free to change them as often as you need to, and let us know if you do ever run out of these. When you have braces on, there are certain foods that you must avoid. That includes anything that is hard, chewy, sticky, or sugary. Any hard or chewy foods will tend to break the braces off. Anything that is sticky or sugary will stay attached to your braces and is very, very difficult to clean off. When left long term, these foods can cause horrible white scars on your teeth and sometimes even tooth decay. After your orthodontic visits, you may have quite sensitive or tender teeth, so please ensure that you have some very nice soft foods at home. Soft things include avocado, smoothie, yogurt, pasta, fish, rice, and quite a big variety of other foods that you can enjoy while in treatment. The first month in braces is going to take some getting used to, and it is not uncommon for certain orthodontic emergencies to occur. In light of COVID, here are some DIY solutions that you can try at home to make yourself a bit more comfortable. It is normal to have some mild level of discomfort and tenderness in your teeth for the first few days after an orthodontic adjustment visit with us. We recommend that you take some Panadol or Nurofen immediately before your visit and continue to do so for every 4 hours as required for the next few days. Eating soft foods will help, and any cold drinks or cold foods will soften our temperature sensitive wires. Conversely, if your teeth are feeling quite tight, please do not have any hot drinks or hot soups, as these will temporarily stiffen the wires and provide more pressure for your teeth. There may be certain parts of your braces that is irritating to your cheeks or tongue. Again, this is perfectly normal and it will take a few weeks for you to get used to having braces. If there are any very annoying areas, please dry the area with tissue or cotton and break a small piece of your orthodontic wax off, similar to the amount you would use for Blue Tack. During the winter time, warm it up between your fingers and push the wax firmly onto the offending part of your braces so it will grip and provide you with some temporary relief. For any ulcers in your mouth, please rinse out with warm, salty mouth rinses twice a day. Bonjela is a fantastic topical anesthetic that you can buy from the chemist and rub onto any ulcers for temporary relief. If the irritation or the sharp areas do not go away after a few days, please give us a call. During the next few weeks, as you learn to eat and talk and brush with your braces, you may accidentally knock one or more of the braces away from your teeth. If this happens, do not worry. The brace will stay firmly attached to the wire, but you may find that it will swivel or slide from side to side. To make it more comfortable, I suggest you take a big mold of orthodontic wax and firmly push it onto the tooth with a loose bracket and extend it onto the two teeth adjacent to it. This will hold the loose bracket firmly in place until you can get in to see us to have it repaired. When new wires are placed in, they are cut flush to the very last brace. But as teeth move around and as you chew, the wires can sometimes move, and this might result in the wire becoming quite long and coming out the very last brace. This can be quite sharp to your cheeks or your tongue. If you wish to manage this situation at home, please use a pair of clean nail clippers or clean wire clippers. And we appreciate that it is often impossible to cut it right at the back where the wire exits. So please try cut it as back as you can and then proceed to pull that entire length of wire out. In doing so, that will remove any excess wire coming out the very last bracket. We will replace any cut wires on your child's next visit with us. Another common emergency in the first few months occurs when you eat particularly hard foods. Now that hard food will push the wire out of the last brace, resulting in a fairly long piece of excess wire almost flopping around in your mouth. There are two ways to address this. You can place the wire back into the last bracket using a pair of tweezers to gently guide it back in. Alternatively, you can also use a pair of clean clippers and cut the excess wire off. You will find a full set of instruction videos on how to manage common orthodontic emergencies on our website under Orthodontic Emergency. If the braces are still very uncomfortable, please do give us a call and we will make an appointment as soon as possible to improve the situation. We recommend that a mouthguard be worn over the braces when playing contact sports. If you need a mouthguard to be made up, please let us know. Please do not make a custom molded mouthguard as your teeth will be moving quite a lot over treatment, and you will find that these custom made mouthguards will not fit for more than 3 or 4 months at a time. During treatment, please also continue to see your family dentist at least every 6 to 12 months for a checkup and a clean to maintain your overall dental health. A full set of these instructions can be found on our website under current patients and braces information. Alternatively, you will find a special red square code on your care packet. Simply open your camera app on an iPhone or a QR code scanner app on any Android phone. Scan this code and it will take you straight to our website. If you have any questions at all, please do not hesitate to contact us and we will assist you to the best of our abilities.